Good afternoon, everyone, or good morning to some of you who are on the West Coast. Thank you all for joining us today for this webinar. We're excited that all of you will be attending our meeting next week for our national strategy discussion, organized by APCHO and the Health Forum, hosted by the Aetna Foundation on the 15th and 16th. And the purpose of our webinar today was just to make sure that everyone who's coming to the meeting next week will have a good foundation, some basic knowledge about the health insurance marketplace, some of the consumer assistance programs. We're going to talk about the role of consumer advocates in the community health centers, and also touch on some of the barriers faced by the AA and NHPI population. My name is Ian John. I'm a policy analyst here at the Health Forum, and I'll be moderating the discussion today. So we have 4 speakers, and I'll introduce each one briefly before their presentation. Just to let you know who we have here today, we've got Anton Gunn from the U.S. Department of Health and Human Services. He'll be providing an overview of the health insurance marketplace. Quincy Nguyen from Community Catalyst will be talking about the role of consumer advocates and talk about some of the different types of consumer assistance programs. We have Dr. Andrea Karakostis from the Hope Clinic in Texas, and she's going to be talking about the role of the community health centers in outreach, education, and enrollment. And then I'll be also speaking about some of the barriers facing the populations that we are targeting. So from what I'm going to do now is turn it over to Anton, and I'm going to give just a brief introduction for Anton Gunn. Anton is the Director of External Affairs for the Office of Intergovernmental and External Affairs at the U.S. Department of Health and Human Services. He was appointed to that position by Secretary Sebelius in 2012. And before that, he served as a member of the South Carolina House of Representatives from 2008 to 2010. In 2010, he was also appointed by President Obama to serve as Regional Director for HHS Region 4, which includes the states of Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee. So Anton, thank you very much for joining us today. I've heard you speak before on many different presentations, and I'm really happy that you can be part of our webinar today. So I'll turn it over to you now.
Well, thank you so very much for that wonderful introduction. So happy to be here with you, happy to take the opportunity to talk about the health insurance marketplace, the work that we're doing here at the department, and how this is an incredible opportunity to create better options and better health for so many people in this country. So without any further ado, I'd like to go ahead and kind of jump right into it. So I'm hoping that you can see my screen in full,
yes,
and that there's no trouble here.
One thing, Anton, before you start, just to let people know, if you have questions during the presentation, we're going to take some questions right after Anton's presentation. So if you think of something, you can go ahead and type the question into the question box on your screen, and we'll go through those questions and answer them at the end of Anton's presentation. Thanks, Anton.
Great. So the first thing I wanted to talk about is just kind of give people a quick sense of our accomplishments thus far around implementing the Affordable Care Act. 95% of all of our regulations have been completed at this point in time. And so we are now putting the information technology into place and testing that technology to make sure that the marketplace works very well for consumers all across the country. So we also know that many states have made the decision about how they plan to implement the marketplace in their state. So the landscape is kind of set. So we know that some states will be running their own marketplaces for consumers. Other states will be in a partnership with HHS. And then we have about 26 states that we will be facilitating a marketplace there for those consumers. And so we know what the landscape looks like. We're ready to move forward. Now it's time to turn the page to focus on outreach and enrollment. So here's some key pieces of information that I wanted to provide for you all about what's happening in 2013. Earlier this year, in April, issuers, insurance companies in the state that plan to participate in the federal marketplace have submitted their qualified health plans, rating, and benefit data. So we now have that information in-house, reviewing it, preparing to put it all together for consumers to be able to shop during October. In addition to that, in 2013, we streamlined this single application and finalized that and provided it to everyone, particularly the states who are going to be working in the same regard. But I want to give people a sense of what this actually means. Normally, people that are shopping for insurance on the private market in current times and most current plans, they're filling out between 14 and 17 pages of information to see if they can qualify to purchase a health insurance plan from an individual insurer. When we first drafted our single streamlined application, it was at about 21 pages that we looked at, and we thought that we could do a lot better than making people fill out 21 pages of information. So we were actually able to get that single application down to 3 pages. So it's now a 3-page simplified application for consumers, and we started making that available for people to look at in April. In the beginning of June, excuse me, at the end of June, we relaunched healthcare.gov, and we also launched our call center. I'm going to talk a lot more about that in the next few slides, but I want to tell you that happened in June. So in August, we'll also begin training for in-person assistance for people who want to assist consumers in enrolling in the marketplace. We'll start that training in August. We also will have the web portal loaded and tested with the insurance company's information so people can start looking for qualified health plans. And of course, October 1st, 2013 is when the open enrollment period begins. So here's what I wanted to share with everyone. If you look on your screen here, you see actually the homepage of healthcare.gov. If you have not visited healthcare.gov, if you have not been to that website in the last 2 weeks, I encourage and implore everyone to go and visit and look at this new tremendous web portal, and where people will be able to get information about the health insurance marketplace, and then very soon we'll be able to use this same website to shop for coverage in all 50 states in the country. And so what do I mean by that, this new and improved website? This is a consumer-facing portal really focused on giving insurance the information that they need to make a decision to buy health insurance, and actually to help them to understand how the insurance marketplace will work going forward. So as you can see, this website is very friendly, very consumer-friendly, very open and facing. It's actually one of the most consumer-focused websites that I've ever seen a government agency produce. So it's a great place for you to gain information and get all of your questions answered about the marketplace. So we thank you so very much for being patient with us to see what this website will look like, and now we're excited about making it available for people so they can know what they get. Also, I'm showing you here, this is a mobile optimized version of healthcare.gov. What we were able to do by working very hard to get these things in line is that our website was designed with responsive design. That means if you open it on a tablet, if you open it on a mobile phone, the website will be responsive to whatever device and operating system that you open this up on, to make sure that you can see the information and is presented clearly for you to make heads or tails of what you're looking at. So this is a sample of what healthcare.gov looks like if you pulled it up on a mobile phone. Also, here's the thing that I wanted to mention is what we launched going forward. This is a very important piece, is that we have a 24-hour, 7-day-a-week call center that's available to answer questions, to provide information to consumers about the marketplace, about what's coming, what opportunities are coming for them. That phone number on your screen is an important phone number. So I'm encouraging everybody to write it down, take a picture of it, post it on your refrigerator, put it on your website, send it to your friends. 1-800-318-2596 is the phone number for our call center to answer questions for consumers. This call center is equipped to answer questions on all kinds of inquiries. So if you have a question around what's an insurance premium, or what's a deductible, or I already have insurance, will I be impacted by the health insurance marketplace, or where can I go to get additional information, and when will I need to make a decision about choosing a healthcare plan? This call center is live right now to answer questions, and we launched this call center in conjunction with healthcare.gov. Now, the most important point that I want to raise on this call, for everyone that is listening, this call center that is now 24 hours a day, 7 days a week, Yes, you can call at 2 a.m. in the morning and ask a question. Yes, you can get your answers question in Pacific time zones or in East Coast time zone. It doesn't matter. The most important thing is that this call center is in 150 different languages, meaning that questions can be answered and will be answered in the language of your choice that fits within that bandwidth of 150 different languages. That's a very important point to make sure that we reach consumers who don't just have English as their first language. Maybe it's their second language. Maybe English is their third language. But whatever their language is in their primary household, they'll be able to make a call to that call center and get their questions answered fully and completely in a language that is comfortable for them. And that's a very powerful tool that we have to have it in 150 different languages. So that call center is open now, June to September, to answer those kind of questions. But once we get beyond September, when we get into the open enrollment period that starts on October the 1st, this call center will help people to complete an enrollment application, determine their eligibility, and perform a plan comparison to help them to pick their choice and to find their insurance option that addresses their issues and provide all the information necessary there. So you can go from just getting information on this call center in June to actually directly enrolling in coverage during the open enrollment period that starts on October the 1st and concludes on March 31st of 2014. So here's a picture of what the Get Insurance landing page on healthcare.gov looks like. You can see it's very friendly, very open, beautiful images of families, mother and daughter on the front page to help them to answer questions and to fill out their application to see your plan choices and what you can qualify for. I'm going to scroll through a few slides so you can kind of see what the website will look like for people who are looking to apply. So if you can see right here, if you click on the Get Insurance tab and click the Begin process, it'll take you to a page where you'll get started to start your application. You got to talk about who you are and if you plan to apply for health insurance. So are you applying just for yourself? Are you applying for other family members or anyone of your same federal income tax return? Are you filing taxes for other family members and thus applying for coverage for them? So you get started right there. You click Next, and it takes you to the next screen. But this is where you will need to have information, your birth dates, your income information, your name, your social security numbers, all of those things that you will need if you plan to apply for coverage for anybody as you start this application process. So it'll take you through, you give your family your household information, your income information, provide other additional information, and then you'll review the application and then sign it. And then once you review and sign the application, it'll give you some results. So those results will tell you what you actually qualify for. Do you qualify for an advanced premium tax credit to help you to buy insurance? And if you do qualify for a tax credit, would you like to use that tax credit to buy insurance? Or do you qualify for a public program like Medicaid in your state? So based upon the information that you put in, you'll get your application results, and then it'll begin taking you through a process to begin registering for health insurance or purchasing health insurance. So the next slide will then take you there and say, listen, you're not enrolled yet. Here's your to-do list to enroll for coverage. You know, you need to set, if you qualify for a tax credit, you need to set what amount of credit do you want to apply towards purchasing your coverage. Then you'll set up your health plan. You'll pick up the things that you want to have on a health plan. You'll have that shopping experience. And then you'll select a plan, and then you review that plan and then sign. So I want to show you a little bit of those slides just to give you a sense of what that looked like. Now I'm going to go back to the call center and make sure I clearly share with you that we're trying to drive a positive consumer, customer-focused experience with the call center as well as the website. But now I want to talk about the call center. So we want to basically clearly communicate to everyone the places that they can go to get help. Again, you can go online 24/7, do an application online at healthcare.gov. If you get stuck or you need some help on that website, there's a 24-hour, 7-day-a-week web chat that's also available for you online. So maybe you don't want to talk to someone on the phone, and maybe you want to do it through web chat. You have the ability to do that. We also have text alerts and reminders available to people 24/7. And when you go to healthcare.gov and sign up, you can actually sign up for text messages alerts to be provided information. Of course, we're providing written applications that are in English and Spanish and notices and letters to people to make sure they're available, made available of everything. And then, of course, the call center, as I mentioned, 24 hours a day, 7 days a week, and we're providing support for 150 different languages. In addition to that, in many states around the country, there will be navigators and in-person assisters to help people to enroll in coverage. And so these are people whose job it will be to help you to understand the process and focus on enrolling in coverage. In addition to that, we like to make people aware that we're training 300,000 agents and insurance brokers to help people to answer questions and actually enroll in coverage. So as you can see, we're trying to build an operational experience that makes it easy, coordinated, focused to answer questions across all channels and provide multiple entry points for people as they look to enroll into the marketplace. So here's a quick snapshot of some of the folks that we know we have to reach with the marketplace information. 41 million people who are uninsured and eligible for the marketplace. There are about 28 million individuals who are eligible and uninsured in those federally facilitated states and the partnership states. There are about 18 states who make the decision to run their own marketplace, and we're well aware of that, but we're also well aware that we need to communicate at a national level, at a state level, and a community level at the same time. We know that 3.8 million rely on Spanish, and more than 1 million more rely on some other language for their primary information. 20% of the target audience has not graduated from high school, and they all are in a variety of poverty levels. We know that some 90% of the people that are eligible for the marketplace subsidies are under 400% of poverty. We also know that the young and uninsured are the most unlikely to have insurance and the most likely to not see the need for it. So we have to communicate to the young and healthy segment and demographic about why they need coverage and make sure this option is available to them. So there's about 17 million 18 to 35-year-olds that we need to reach. 58% of that audience is male, 42% is female, 26% Latino, and 18% African American. So we know that older folks, folks who are sicker, who are worried, that need coverage, they're going to find the marketplace. But how do we make sure this young and healthy demographic also gets engaged and find the marketplace? That's the national snapshot of the folks that we know that we need to serve and we need to reach. So here's something I want to share with you, is that we're also not just going to have navigators and a call center and a website to reach people, but we will also be developing and engaging in a digital campaign to reach people. So we will have, as you see here, widgets and banners and posters, many different pieces of information that can be used digitally on a website and scrolling across a news feed of some sort. This is all kinds of information that is made available. This is also being made available to our partner organizations, people who want to work with us and want to help us champion coverage opportunities for the millions of Americans who need it. This information is available to you, that we'd be happy to help you to get a widget for your website or give you something, a button to put into your email as you send out emails to your list and to organizations that you work with. So we want to make digital content available for as many people as possible. In addition to that, for other partners, we want you to be able to get other resources to help people apply and enroll and get coverage in the coming marketplace year. You can do that by going to marketplace.cms.gov. This is a great place for our partner organizations to explore, research information, get official tools to help you to communicate about the health insurance marketplace, to help you to get the message points on how we're communicating with the American public about the marketplace. And so this is all available at marketplace.cms.gov. I wanted to show some samples of some of the publications that we're making available to our partners. As you can see, we want to have brochures available about the health insurance marketplace, about the value of health insurance, about the Small Business Health Options Program to let small business owners understand and know what they need to do to help take advantage of the marketplace. We also have fact sheets and checklists to help people to get ready for the marketplace. What do you need to know that if you're going to look for health insurance coverage in the health insurance marketplace? You need your Social Security numbers, you need your birth dates, you need your W-2 forms or wage and tax statements, and any policy numbers for any coverage that you have. So these are things that we're putting in our fact sheets that we want to make available to our partners to download right from our website, to print them out, put them in your lobbies, your waiting rooms. You can even repurpose this information and send it out to your list if you wanted to do a special electronic communication with your list around what do you need to know to get ready to apply for the marketplace. So fact sheets, brochures, checklists are all being made available. We also have posters and postcards. As you see here, these are ways that things that you can put up to talk to people about the marketplace and explain to people what they need. Do you need health insurance? Do you know that new coverage options are available to you? Sign up at healthcare.gov. Visit healthcare.gov. Learn more on how you can get ready. And then also making resources available to people. We also, again, as I mentioned, have badges and widgets that ask simple questions. Learn more about the marketplace. Get answers to your questions. Do you own a small business? Do you run a small business? Are you interested in coverage for your small business? All of these badges and widgets are being made available to many of our partners, and we'll be happy to share this information with all of you. So as you can see, here's some text information that we're also making available. We know that people communicate in a 21st century way in the 21st century, so making text messages available with the appropriate information about the marketplace is what we're trying to share. So we want to let people know that these things are available to them. We also have other stakeholder materials. So if you want to do fact sheets that are particular to your group, if you want to have posters put out to announce that you're going to do an event to educate people about the marketplace, we have all kinds of stakeholder materials that are available to you on our website, again, marketplace.cms.gov. So again, a fillable flyer event. If you want to host an event, you can have a pre-made flyer for that where you can just fill in your information and direct people to how they can get information from you about the marketplace. And then we have infographics that we're making available on healthcare.gov that we want to make available in lots of other places that explain to people how the marketplace works. It's a very useful tool. Infographics is a great way to explain people complex information, and we found a way to simplify this as much as possible by providing it here. So we also have YouTube videos. You can go to youtube.com/healthcare.gov and get video testimonials about people who've gotten coverage, or a video that explains to you how you will be shopping in the marketplace come October. So all of these things have been made available for people to you. I also want to share quickly, we have information in English and in Spanish. We're making it available in other languages as well to make it available for people to be able to use. You can see in this document, I don't know if you can see, but there's multiple languages here listed on this document to get these messages available in English and Spanish as well as many other languages. We also have radio PSAs that we've designed. So one called Better Options, Better Health. And if you want to put together a PSA that speaks particularly to your constituency, groups that you work with in your community, you'll be able to get a radio PSA drafted by us with the appropriate information. We also, again, have multi-purpose text messages. What are we talking about this summer? Getting people prepared for the marketplace. But then we have different messages once we reach October to explain to people that open enrollment is here. You also see images on the right-hand side of your screen that messages could go on receipts at businesses like CVS, and other businesses that you can explain to people that there's a new health insurance marketplaces and let them know where they can go to apply for coverage. So we also have a limited number of quantities of materials that can be ordered at no charge to organizations who are doing outreach on the marketplace. If you want to place an order, you have to go to our product ordering website and create an account, fill out the required fields, and once we approve your account in about 3 days, you can browse and order some products to receive email notifications of other opportunities to pre-order new products. That website is productordering.cms.gov. Again, productordering.cms.gov. And with that, I'm going to go ahead. I know we're running short on time, but I wanted to get to the last slide and make sure everybody understands this is what you can do to help us more than anything else. You can help us by raising awareness around the marketplace and what's coming. You can do activities around the launch and the relaunch of healthcare.gov. Make sure people are familiar with this website. And also, you can have members participate in educational webinars, such as the one we're doing today, and then help them to educate others by doing the same. You can share our information via digital, social, and earned media, paid media channels, so we can really get this out there to people. And the second thing you can do to help us is to support our enrollment efforts. We have an opportunity to train persons as assisters to help people to enroll in the marketplace. We're very happy to have organizations who want to be partners with us to have their staff members, their volunteers, certified as application counselors to help people through the application process to enroll in coverage. Or you could also provide space for enrollment or help us to host enrollment events where there are opportunities for people to actually sign up for coverage. So these are the things that we've made available to the marketplace thanks to our work on healthcare.gov, and we're very happy to have you all on the phone today and looking forward to having more partners. So with that, I'll be happy to take some questions.
All right, thank you very much, Anton, for all that information that HHS and all the work that HHS is doing. At this time, I'd ask individuals, if you have questions, please type them into your question box on the screen, and we can read them and have Anton see if he can answer some questions. One question that's come up, Anton, for the consumer publications, I know there's various things that are out that you mentioned. What different languages are they available in, and how can people get those? You mentioned about ordering materials. What languages are available for people to order materials in?
So right now, the materials are being made available in 15 different languages. I don't have that list of languages in front of me, but again, you can get a sense that we're starting at 15 and looking to grow that to more languages. All of our information, all of the questions could be answered verbally, of course, supported through the call center in 150 different languages. But right now, we have 15 available. And I'm happy to make sure that we get back after this call a full list to you and all of the groups, the 15 languages that we have most of our stuff made available in now, and then provide that fully to you. And of course, we'll let you know as more languages come online.
Great, that would be great. Another question concerning the call center. You said there are 150 languages available. Can you talk more about how the language services work? Is it through a language line? Are there actual people that speak the different languages in the call centers? Could you talk a little bit more about the call center language services, language access?
That's a great question. What I've learned from my colleagues at CMS is that we have done a yeoman's job of trying to make sure that the wait time for people to get their questions answered is being shrunken down to less than 2 minutes, and they actually get to someone who can speak to them in the language of their choice. And so I think we're operating this call center robustly ourselves, so you won't be transferred out to another organization or another group to do the language translation, but making sure that we have customer service representatives who can manage the diversity of those languages right there at that one call number.
Great, thank you. Another question, would it be cost-effective to translate the application in more languages instead of the translators to support each application? So I guess the question on the translation of the application itself.
The application, that's a great question. I mean, one of the things that I know that everyone here is trying to do is to figure out how to try to be more efficient in making sure that we connect the dots in the right way. And so we know that the application itself will be translated into a few languages, but it's not as robust as we want it to be and what we know other folks to be and we're trying to use as much of our resources as we can to do it efficiently and effectively for people. So I don't have a great answer as to whether or not it's more cost-effective or cost-efficient. To some degree, we have, we have a huge job in a limited amount of time to make sure that we're ready and get things prepared. So some of this, what you see today or what you see on October 1 may not be exactly what you see on December 31st or even March 31st, because we have the beautiful thing about this process of having a 6-month open enrollment period is to try to improve upon the progress, the tremendous progress that we're making to make sure that we can make more materials available in more languages and in more efficient ways to make sure that we get people enrolled in coverage. And so that's what we're working towards now. I did just get a quick update to let you know that we will have it, the 15 languages that I've talked about, the materials will be available in. Chinese is one, Korean is another one, Vietnamese is the third. It's also in Polish, Russian, Portuguese, Creole, Arabic. So there are many different languages that we are trying to make it available for, and we're going to continue to move forward to try to add more to that mix.
All right, great. Thank you very much. Just a couple more questions here. What happens if a person an LEP consumer is not satisfied with the call center operator in providing their in-language information? Is there a way that they can go to address that if they're not satisfied with the language assistance that they're getting through the call center?
So I don't have a firm answer to that question, but I will tell you this, is that as I mentioned earlier, we're trying to be as responsive as possible to all inquiries, all concerns that we have with the call center, as well as the website. So for instance, if you go to the website and you cannot get information that answers your questions or suits your needs, we have an immediate feedback loop right on the website, right in the particular area in which you're looking for information. We ask a question at the end: are you satisfied with the information that you received? And if you have not, you can put in what you're not satisfied with, even type it in right into a text paragraph, and that'll get right to our analytics team. And we're making real-time changes. So if we see that information is being asked for specifically by large numbers of people and it's not already listed on the website, we're going to make those changes and move that to the front and have those answers. And so the call center, the intent of the call center is the exact same way, that if someone is not satisfied, we want to make sure we have a feedback loop, an active feedback loop, to make sure that we get feedback in that process, and they can do that right through the call center.
All right, great. Well, one final question. If a particular language is not available and there's an organization that would like to translate materials in that language that is maybe used quite a bit by their community, what steps do they need to take in order to do that? We're
very happy to have them to do that. We can just connect them with CMS. So again, if you go to marketplace.cms.gov and sign up on our list, there's an email address there that you can make that inquiry if you love to provide those services and to help us to provide that assistance. We'd be happy to take that support by connecting them with our CMS team, who can help get them the materials that they would need to have in order to be translated.
Okay, great. Thank you very much.